Mental Health Awareness Campaign. The problem. Mental health is a growing concern in our community and should never be taken lightly. Teenagers and young adults are the ones who most frequently experience anxiety, depression, and high levels of stress. The biggest problem is the stigma surrounding this issue.
This issue truly matters because mental health affects almost every area of your lives. Your performance in school, your relationships, and even your self esteem. It also affects entire families when isn't enough support. If left untreated, problems can worsen, so it is important to raise awareness and provide clear and accessible information. This research shows that it's not a small problem. For example, the World Health Organization says that 1 in 7 adolescents lives with a mental health disorder. According to the CDC, anxiety and depression have increased in 2019, especially after the pandemic. And the NIMH report that half of a mental illness behind before age 14. This data shows that a lack of education and stigma are truly impacting your community.
Propose solutions. For education workshops, we can host short sessions on stress management, recognizing anxiety or depression, and going over some healthy coping habits for those with mental illnesses. For awareness posters and social media, we can use simple messages and hotline information to spread awareness around the campus and online. For a peer support initiative, we can train volunteers as mental health buddies to guide students who are struggling to resources and help that is available for them. For partnerships, we can work together with school counselors, clubs, and local mental health organizations. And to create safe spaces, we can make weekly check-in meetings or reunions where students can have the opportunity to express their feelings and ask some questions if they desire to.
As for the project logistics, I'll split it into roles. One person will be organizing everything, and then a couple people will be in charge of creating the content, like the posters and maybe the posts online that we will have for our campaign. And then there will also be a couple of people that will be trained to be leading the workshops that we will have for the students. We will just need a couple simple materials like poster paper, printer access, classroom space, and then the handouts. For the partners, we will be connecting with counselors, clubs, and local nonprofit organizations that deal with mental health so that they can be our resource, so that we can lead our students into having their little backup plan and something that they can rely on too. To spread the word, we will be using weekly social media posts that will serve as their advertisement to know when every meeting is and the get-togethers and the workshops will be at, and most of the information will be handled through social media. Since this is a very low-cost project, the only expenses are printing. And then the workshop and check-ins can happen during a period of time where students don't have class or once they're done with all of their classes for the day. It can also be whenever we can have a classroom space reserved. These are the results that we expect to see if the campaign is followed through. First, the students will have a better understanding of what mental health struggles look like on themselves and maybe on people that surround them. Second, talking about mental health will make it feel more normal, which will also reduce stigma. And then third, more students will feel comfortable in reaching out to their counselors or just joining the check-ins. And then overall, we are hoping that students start using the healthier coping techniques that we will be teaching in the workshops. As for the timeline, it is very simple. Week 1 is for planning and designing all the materials. Week 2 is for the campaign launch with posters and then social media advertisement that we will have with our team. Week 3 is when the first workshop and the check-ins will start. Week 4 it will also include another workshop and a survey to see if the students are feeling more comfortable and if they are feeling like our workshops are helping them. And then week 5, we will focus on sharing the resources and anonymous student stories, talking about if they have been experiencing any anxiety or have been struggling with their mental health. And then we will be mainly focusing on seeing how we can help them. And then lastly, week 6, we will wrap everything up with a final workshop. And then we will also be reviewing the impact that our campaign had.
Mental health is a real need within our community. Together, we can create a safe space where people feel heard, understood, and supported. Always remember, you are not alone.